Further debate? The member from Don Valley East.
Thank you very much, Madam Speaker. It's an honour to rise in the chamber to address the euphemistically named Your Health Act. I'm going to mention that it will take a significant amount of restraint to maintain the decorum in this chamber, but I do want to acknowledge that we have some incredible youth from Oakville who are here because they are going to inherit the healthcare system that we design. Their parents and their grandparents are going to be using it if they're not already using that healthcare system. And we must be deeply invested in ensuring that this healthcare system will be there for them now and forever into the future. And I'm sorry to say that this bill is the first of many more steps that will see it undermined, dismantled, and deregulated. So where are we right now? We have gone through a series of public hearings, clause-by-clause review, and had the opportunity to submit innumerable amendments. In my case, I have submitted so many amendments to improve this bill that the package I submitted for review by the Standing Committee on Social Policy outnumbered in pages the number of pages in Bill 60 itself. That's right. This bill, unfortunately, is so flawed, so sloppy, and so poorly conceived that it has taken more work to fix it than to write the bill itself. But of course, this government is not interested in fixing anything. It will come as no surprise that they actually voted down and said no over and over and over again to improvement after improvement after improvement that I proposed. So today I'm going to demonstrate three things, Madam Speaker. The first is I'm going to show how this bill is fatally flawed. I'll demonstrate this by my testimony and also by referring to the feedback that was received during public hearings. I will demonstrate that it was salvageable, and I will walk you through my amendments, which were all voted down. And then I will demonstrate that it must not be passed. I will demonstrate that by showing how the members across opposed every single attempt. This government loves to rail against the status quo without acknowledging that they, in fact, are the status quo after governing for 5 years. The moment they took power, our healthcare system immediately embarked on a significant nosedive. They cut hundreds of millions in public health funding, cut staffing solutions like the Practice Ready Assessment Program, and they enacted unconstitutional wage capping legislation like Bill 124. And instead of solving these issues, getting at the root cause of the challenges we face in our healthcare system, they instead are proposing this poorly conceived, superficial policy that lacks thought, detail, or any semblance of understanding about the challenges that we face today. It continues in a series of failed policies, like the failed effort to increase credentialing of foreign-trained healthcare workers, the failed effort to regulate temporary for-profit nursing agencies, and the failed effort to reassure us that Ontarians will always pay with their OHIP card, not their credit card. I've heard enough about Life Labs and that how we will always pay with our OHIP card there. To any of the gentlemen across, try and get your PSA test, and when they ask you to pay $30, hand them your OHIP card and tell me what happens. We don't need to look further than virtual primary care to discover OHIP services already locked up behind paywalls and credit cards in this province. Try and book an appointment with the virtual primary care service. And when they ask you to pay $70, hand over your OHIP card and tell me how that goes. Here's the issue. The rate-limiting step in our healthcare system is health, human resources, and staffing. The Ontario Hospital Association has acknowledged this. The OHA, and I quote, has consistently advocated that Bill 124 should not be extended, nor should additional restrictions be imposed, due to its impact on availability of HHR and other impacts on hospital operations. Yet this government persists stubbornly in Bill 124 and defending it even after it has been noted to be unconstitutional. And I would like to thank the OHA for their incredible efforts during the pandemic and as they continue afterwards. Let's also not forget that by 2028, this government will have underinvested by over $23 billion, according to the Financial Accountability Office. That is not addressed in this bill. One of the most shocking things about that figure, by the way, is it's $23 billion of underinvestment in relation to promised investments. It doesn't speak about the many investments that have not even been promised, and the fact that this government is a masterclass in tokenism. In the last budget, they said, I think, that they're going to bring in 50 foreign-trained medical doctors. 50, when we have 2.2 million patients who don't have access to a primary care physician. That's not in this bill. So amidst this comedy of incompetence, we have a murky new bill that proposes moving surgeries and diagnostic services out of hospitals in an unregulated manner. And I've pointed out the shortcomings of it from the very beginning. I pointed out that its full impact won't really come into focus until it has been passed, because so much of the stuff that matters in making this bill successful has been left to the regulations. Who will perform oversight? Is the oversight body external or internal? And without such details, how can we possibly believe that there are credible protections against upselling or upcharging? After all, this government has, of course, as we all know, ignored all of the recommendations by the Auditor General in regards to upcharging and upselling in out-of-hospital facilities. So here's what's wrong with Bill 60. Number one, as I mentioned, it completely misses the point of our healthcare crisis, notably the fact that there are massive staffing issues and massive underinvestment. It barely even pays attention to the things that matter: oversight, protection against upselling and upcharging, and it doesn't deliver any of the details. And it asks us to sign a blank check. Believe it or not, it proposes to redefine what is a physician, what is a registered nurse, and what is a registered practical nurse. And believe this, it doesn't say what the definition is going to be. It just says the old definition was thrown out the window, and the rest will be decided in the regulations, an opportunity when we will not be able to have any say in the matter whatsoever. I want to pause and be clear about something. There is merit to moving surgeries and diagnostic services out of hospitals. It can reduce the backlog and increase accessibility to services, but it needs to be done the right way, and this is the way to do it. It needs to be done in a not-for-profit manner, linked to hospitals, monitored with strong ministry oversight, compensated at the same rate as hospitals, prevented from draining the public system of health human resources, and there should be no opportunities for profiteering or upselling. Above all, it must be safe. And I'll speak very briefly to the challenge of for-profit care delivery, because I've heard it come up over and over again in the debate today. There are consistently worse outcomes in for-profit healthcare. Healthcare must always prioritize patient health, never private wealth. And we have seen in countries all around the world and throughout Canada what happens when for-profit interests take priority. We saw in for-profit long-term care homes where there were worse outbreaks and more deaths. We've seen it in for-profit vaccination clinics here in Ontario, where there is increased wastage and less uptake of vaccination compared to the ones that were offered by hospitals, and over and over and over again. So we've also heard, even in the debate today, a number of people speak to some people who have said that they think Bill 60 is passable. And I want to quote from some of those very same people. The Ontario Association of Radiologists, Dr. Vic Agarwal, who was just quoted a little while ago. In public hearings, he identified the following concern in regards to corporate for-profit interests. He said, and I quote, "I guess what I'm saying is that I'm a doctor. My interest is in treating patients. I'm not a business person. I look at spreadsheets when my accountant shows me one. I'm not a slave to a line on a spreadsheet, whereas people I know in business, they're very concerned about their shareholders and what they're paying out. So what I would say is that if you have people owning these clinics who aren't physicians, we open ourselves up to risk." He proposed an amendment that these out-of-hospital centres should be operated and led by physicians. That was voted down. Dr. David Graham from Scarborough Health Network said the following. I would also say that, and I quote, "I would also say that when you read the bill and look at guardrails that are provided, I think the biggest concern for a lot of people is on the health human resources part of the bill. Requesting that detailed planning comes out that actually outlines what those resources are by procedure, I think is an important safe guardrail for that. That has not been done in this bill." And I'll skip the remaining quotes, but I've got here Dr. David Graham, I've got Dr. Kevin Smith, all hospital CEOs, all very respectable individuals. I've outlined the protections that needed to be in place. I've outlined the fact that there needs to be accountability and transparency on things like what the definition of a doctor should be. And here are the very concrete ways in which I tried to salvage this government's bill. I submitted 45 amendments, and they were not controversial. Like, try this. The director and the inspectors shall have a duty to consult Indigenous people in the planning, design, delivery, and evaluation of health services in their communities. What could possibly be controversial about that? I thought we were serious about truth and reconciliation here. That was voted down. I submitted an amendment to make sure that maybe it would be nice to have someone competent in overseeing the integrated community centres. So I said a director must be chosen by a competitive process and must be an individual employed in the Ministry or by Ontario Health, or an entity such as a regulated health college that has a responsibility to act in the public interest. That sounds extremely reasonable to me, nonpartisan, and for which there's plenty of precedent. Voted down. I submitted one about staffing. The application must include a health human resources plan that satisfactorily deals with how the operation of these service centres will be coordinated with local hospital and regional needs. And I gave some criteria. Voted down. So let's prioritize patient care. We've seen what happened in for-profit long-term cares. And given the opportunity to support not-for-profit, this government has said no. Then I said, maybe there's a way that we can protect even within a for-profit model. I said, make the directors of a for-profit corporation fiduciaries of patients, meaning that their obligation to protect patients must come before their obligation to protect shareholders. Who could possibly disagree with that? This government. 45 times over, this government said no. They said no to the things that would protect all of us. So now we have a bill that misses the mark, a bill that was significantly but not fatally flawed in the beginning, but is fatally flawed now. We heard these errors articulated by so many people who came through the door during public hearings. We saw this government ignore the advice of every single person. I received emails from some of the people who came and gave public testimony, in fact, saying that they felt insulted by government members who ignored them, who spoke over them. I proposed so many concrete ideas to make this bill stronger. And again, this government, I suppose that when someone makes an accusation about something, it actually reveals more about themselves. This government voted no to all of them. So this bill fails. It puts patients at risk. It undermines our healthcare system, worsens our staffing crisis, and it must not be passed.
Thank you. Questions? The member from Durham.
Thank you, Madam Speaker. The member from Don Valley East is a member of the Ontario Medical Association. Alan Odette, the CEO of that Ontario Medical Association, says this about Bill 60, that it appreciates the collaboration with Ontario's government and their commitment to thoughtfully implement the shift of more procedures out of hospitals into the community. We are very encouraged by the legislation, which, if passed, aligns with OMA's recommendation to replace the Independent Health Facilities Act with a more comprehensive framework that strengthens prohibitions against two-tier health care. How can this member opposite not support Bill 60 in light of what the head of his organization says?
Thank you. Response?
Thank you very much, Madam Speaker. The quote that was just provided is just so typical about how this government governs governs the things that matter most to all of us. Because what he said wasn't the complete story. If he kept reading, he would know that the Ontario Medical Association has published a report in which it explicitly said that out-of-hospital surgical facilities are recommended. They want them to happen in an explicitly not-for-profit manner. So I have no problem speaking to the words of the person who represents the organization I belong to, the Ontario Medical Association. I have no problem speaking to that. All I ask is that we speak to all of the words that the OMA has said. And the OMA has said that these facilities should operate in a not-for-profit manner, which is not what Bill 60 does.
Thank you. Questions? The member from Humber River Black Creek.
Thank you, Speaker. The member spoke very passionately with a lot of experience on this issue, and I want to note that we've heard government members read out quotes from doctors, so I'm really happy to be able to hear the opinion of a doctor here in this chamber who's speaking quite against the legislation. But you mentioned on the PSA testing, and very recently the Conservative government voted against a motion to have this important men's health option covered by OHIP. Can you talk a little bit about that? Was that a good move or a bad move by the government?
Thank you. Response?
Thank you very much for your question on that. PSA is a leading cause of death amongst men in our country, and it is preventable if it is caught early. And there are two ways to catch it early. One is a digital rectal exam, which I am sure that no one in this chamber would relish, and the other way is a blood test. Now, both of those methods are not perfect methods. But every patient in Ontario should have the opportunity to choose a manner in which they can be protected from having a preventable but sometimes fatal cancer. There are many reasons why the digital rectal exam, and I leave it up to your imagination, but even in the most marginalized and vulnerable populations, there are many reasons for which getting that rectal exam is not the right option, that getting the prostate-specific antigen or PSA test is the right option. And charging $30 for a PSA test actually discriminates against the people who are at highest risk of having prostate cancer in the first place, because we know it is in those marginalized and vulnerable communities that they cannot afford the test, and those are the ethnicities and communities most likely to succumb to prostate cancer.
Thank you. Questions? Questions? The member from Scarborough Southwest.
Thank you very much, Speaker. I want to thank the member for his speech, and I know how passionate he is on this issue, especially being a healthcare professional. And one of the things that you touched on already was how our public healthcare facilities and our public healthcare workers are taken away overnight and then turned into private healthcare facilities, and then the public healthcare workers are then used for service that we should get in our public healthcare system, and how scary this is in terms of the trend that we're setting. And I always talk about what it means for my family to have that public healthcare system and the ability to walk in and get that service. And I know this government talks about how you're going to pay, with an OHIP card, not your credit card. But we are already seeing the reality. So I would love to hear your thoughts on what's happening as a doctor.
Thank you. Response?
Thank you very much. I think that at the very crux of your question is what will happen to staffing under this model, and we have contended that it will siphon healthcare workers out of the publicly funded healthcare system. That is certainly my opinion, but I'll ask you not to take my word for it. We've heard from many CEOs. This one, Dr. Kevin Smith, who I didn't get around to quoting in my earlier remarks, actually said, and I quote, "For me, the greatest worry is that people are so tired and burnt out that we run the risk of not having adequate people for the true emergencies, for the true inpatient stay. The number one unintended consequence I think we all have is a health human resource shortage." He gives some examples of why it would be more enticing to go into a private clinic. And he says, doesn't that sound attractive? And of course it does. There are no protections. You can say over and over again, as many times as you want, that there are protections in this bill. But the very reality is that they are not in the bill. I invite anyone to point to them. But it's superficial, it's cursory, and in theory all left to the regulations, and I question whether those will even appear.
Thank you. Questions? The member from Ottawa South.
Thank you very much, Speaker, and I want to thank the member for his last answer, because it was pretty much answered my question. The concern here is setting up a parallel system that competes for what is probably the most valuable resource that we need right now, which are frontline healthcare workers in our hospitals, long-term care homes, in our community. And so, I know that Bill 124 had a big effect on the retention and recruitment of nurses, for instance, and other frontline healthcare workers. Can you further expound on why there is a risk to our public healthcare system because of the human resource crisis we have right now, and siphoning off those resources, those people on the front lines that we need?
Thank you. Response?
Thank you very much. The reality is that the backbone of our healthcare system is our healthcare workers. We have been pushing them harder and harder and harder over the course of the pandemic. They are suffering from mental health challenges. They are suffering from burnout. They are not feeling valued. Bill 124, the unconstitutional wage capping legislation, has told them concretely that they are not valued. And as they go to the few places that remain that have the potential to pay them more, which far too often is in acute care, and now lately has become temporary for-profit nursing agencies, which this government will not take any action on, the result has been that all the other places that we need healthcare workers, such as primary care, home care, community care, and long-term care, cannot staff their facilities. And so the legs of our healthcare system is getting pulled out from underneath it. And this is the fundamental problem. Our healthcare system and our hospitals are not made out of beds and concrete. They are made from healthcare workers, and this government does not value them.
Thank you. Questions? The member from Windsor-Tecumseh.
Thank you, Speaker. I want to thank the member for his viewpoint and perspective being right in the field. I wanted to just ask if you have any thoughts or have a degree of support for the measures to expand the scope of pharmacists so that they can prescribe and sort of get into that space that was previously in the sphere of physicians themselves.
Response?
I thank you for that question. The first thing that I will say is expanding the scope of practice for pharmacists is a measure that has been foisted upon us because this government does not value primary care. And if we got primary care right, we could actually do something about that. I want to point out that even as this government brags about creating new places in family medicine, the current places that are available in our universities to train new family medicine graduates aren't even getting filled. They're not getting filled. So what's the point in creating more? Because this government has made family medicine and primary care so unattractive. But in the crisis that we're in, a crisis of this government's creation, we need all the measures on the table.
Response?
We do need to expand the scope of practice, but it has to be done the right way. And even though there is room for pharmacists to do more, this government has not implemented any regulations or protections to make sure that they communicate with primary care, to make sure that there's adequate documentation, to make sure that there's adequate regulation and requirements to ensure that physical examinations are done properly.
Thank you.
Thank you.
Questions? The member from Elgin, Middlesex, London.
Got it. Thank you, Speaker. Appreciate the passion and the experience the member opposite has in the healthcare system, but I believe our healthcare plan will reduce surgical backlog and improve quality of life for patients throughout this province. Will the member opposite please identify to my constituents at least, that by supporting this bill, it will ensure Ontarians aren't waiting too long for surgical surgeries and backlogs. It is there. We have to fix it. We have a plan. We're giving it. I think it'll work.
Response?
My message to your constituents is that they want a family doctor, and this government is not doing anything about that. And if they can get to a family doctor, we can start dealing with the issue of those surgical and diagnostic backlogs. That's the message I would ask you to take back to your constituents.